Hello guys, welcome back to my channel. Today in this video I'll be telling you about the adrenal gland pathology and the complete adrenal gland I'll be telling you. So let's get started. So on the activation of signals from the hypothalamus as already mentioned to the anterior pituitary, adrenocorticotropic hormone is released. So let me show you back the picture of this depiction. Right. So as a result of stimuli, the hypothalamus from anterior pituitary will release adrenocorticotropic hormone and it will act in the adrenal gland. So as a result of stimulation of this hormone, what happens? Let us see. So first of all, the adrenal gland is divided into two portions, cortex and medulla. In this picture, as you can see, the outermost is the cortex and the inner is the medulla. Now this cortex is divided into three zones. The outermost zone is called as zona glomerulosa, the middle is called as zona fasciculata, and the innermost is called as zona reticularis. So you can remember it as GFR, glomerular filtration rate, right? Another name. So you can remember it in that way. As adrenal gland lies above the kidneys, so kidneys have structure functional unit is nephron. So in the nephron we have GFR, that is glomerular filtration rate, so it is connected with that, so you can remember in that way easily. All right, moving on further, the zona glomerulosa produces certain hormones, steroid hormones, that are called as mineralocorticoids. The mineralocorticoid include aldosterone and corticosterone. The middle portion is called as zona fasciculata. That zona fasciculata will produce glucocorticoids. Glucocorticoids are examples like cortisol and cortisone. And the innermost layer is produced, that is called as androgens. And the androgens hormones mainly include estrogen and testosterone. All right. What happens in the medulla? In the medulla, the catecholamines are released. Catecholamines include epinephrine, norepinephrine. About them, I'll be dealing in depth in pharmacology. All right, moving on. And certain other peptides are also released, like somatostatin and substance P. So this is being the general physiology. Let's move on to some pathology. So we have the first one. What if the adrenal gland, particularly the zona fasciculata, produces less hormone, that is cortisol, and even zona glomerulosa produces less aldosterone? So what happens? There is a condition, there is a pathology, it is named as Addison's disease. Now what is the cause of this Addison's disease? The Addison's disease is caused because of not enough of steroid hormones like cortisol and aldosterone. It can be due to autoimmune processes, autoimmune destruction. Tuberculosis can be the cause, tumor or metastatic disease, and surgical ablation of adrenal gland can be possible. Hypofunction, please remember, adrenal gland hypofunction is the example of Addison's pathology, Addison's disease. All right. So, what are the clinical manifestation of this Addison's disease? Now, the adrenal gland, since it is affected, it cannot produce steroid hormones. That's the main. Then, hyperpigmentation is possible. Low BP because of less activity of corticosteroids. Weakness, weight loss can be possible, and GIT influence are mainly concerned with nausea, diarrhea, vomiting, constipation, etc. And the skin goes dry, so it's vitiligo, and adrenal crisis may develop. As mentioned over here, in severe conditions, it can lead to adrenal crisis. Now, the adrenal crisis is characterized by fever, syncope, convulsions, hypoglycemia, hyponatremia, Why hypoglycemia? Less cortisol. Why hyponatremia? Less aldosterone. Natremia means nothing but sodium level. And severe vomiting and diarrhea is possible. So this is being the Addison's disease. Now let's compare it with another pathology that is called as Cushing's disease and Cushing syndrome. These both Cushings are very similar in name, like they tend to be similar, like students confused between these two, but I'll make you understand very easily. So the Cushing's disease or Cushing syndrome, what happens is that in both the diseases, that is disease and syndrome, the cortisol level will be high, whereas the adrenocorticotropic hormone level in Cushing's disease will be high, and in Cushing syndrome it will be low. Why is it so? Because there is tumor in the anterior pituitary gland. If there is tumor, that is adenoma, the and adrenocorticotropic hormone will be released more. Whereas in the Cushing syndrome, the pathology lies in the adrenal gland itself. So the ACTH will be low. Now you got the point, right? Moving on. What are the symptoms of Cushing's syndrome? Let us look at the symptoms of Cushing's syndrome. Cushing syndrome is mainly concerned with such symptoms like buffalo hump, moon face, muscular weakness, skin thinning, and it can affect in bones like increase of fracture risk, and in reproduction, irregular menstruation in female and erectile dysfunction in males, and certain psychological conditions like depression, anxiety, and general conditions include weight gain, fatigue, glucose intolerance. So the main point is you to need to remember is that moon face, buffalo hump. In any questions you get to see, please mark it as Cushing's. But be careful whether it is Cushing disease or Cushing syndrome. All right, moving on further. Now, what will happen if there is hyperfunctioning of adrenal cortex, zona reticularis? As already mentioned, zona reticularis will produce androgens, so there will be adrenal virilism, that is excess of androgens. As you can see, what is the main cause is that it can be congenital or it can be acquired. So it is mainly concerned with such signs like hirsutism, excessive development of hair in the body parts, baldness in women, hirsutism. These all are the characteristics in women. Deepening of voice, amenorrhea, and atrophy of uterus, increased muscularity in women, whereas the opposite things are found in males, like decreased production of testosterone and decreased in length of genital organs. So that are certain secondary complications which you need to remember. All right, moving on further, let me tell you about the aldosterone, that is zona glomerulosa. Zona glomerulosa produces aldosterone, as I already mentioned. Now, what does this aldosterone do is that it will stimulate the RAS system. The RAS system, that is renin angiotensin aldosterone system. I'll make a separate video for you, especially. You can go and watch over there. What is the end result of this is that the sodium concentration is increased. With increase of sodium, there is increase of water. With both of these increase, there is increase of blood pressure. So to bring back the normal BP, I mean low BP to normal, this system is activated. So what happens in primary aldosteronism? I'll tell you, there are two hyperaldosteronisms, primary and secondary. So the primary hyperaldosteronism is called as Conn's syndrome. Please remember the names. These clinical names are really very important when you encounter multiple choice questions. So please remember. So what happens is that the cause of this syndrome is due to tumor of adrenal cortex or benign adrenal hyperplasia. So as a result, there will be increase of sodium, increase of chlorine, And one more function that aldosterone does is that it decreases the potassium level. It decreases the potassium level, and as a result of this, as I told, there is increase in BP, that is hypovolemia, increase in volume. So what will this hypokalemia get manifested with? Hypokalemia is manifested with muscular weakness, paresthesis, transient paralysis, and tetany. Hypokalemic nephropathy with polyuria and polydipsia, that is increase of urine and increase of sweat. So this is possible because of complications of hypokalemia. Whereas hypernatremia will cause hypertension, as I already discussed, as I already mentioned. But in this case, the renin activity can be low or even normal. So please remember this, it's very important. All right, moving on to the last part of our video, that is secondary hyperaldosteronism. The secondary hyperaldosteronism is caused by the low blood circulating volume or low arterial blood pressure. So it can be due to renal artery stenosis or due to ascites, that is excessive fluid development in the abdomen, cardiac failure, nephrotic syndrome, and renal vasoconstriction. These can trigger the hyperaldosteronism so that the blood pressure can come to normal. So this is about aldosterone, about androgen, about cortisol, and about Addison's disease. So hope you liked my video. Please subscribe and share as much as possible. See you soon. Bye.